nipping it in the bud and saying, look, when that person first presents, that's when you have the biggest opportunity to get them on a healthier path.
Yeah.
And so by having the appropriately trained people in the community and sensitizing the primary care providers to it, what we found is it kind of caught on like wildfire.
Yeah.
That it started as a pilot with a few doctors and a relatively small number of physical therapists and chiropractors. We now have over 500 people in upstate New York who are trained, and we've seen significant improvements in many of the locations where we've implemented this, where we see lower use of high-end radiology services, lower surgery rates, lower hospitalization rates, and patients who 6 months out are extremely satisfied with how they're doing and what their outcomes are. So we're not compromising quality. In fact, I think we're improving it.
Yeah. That's great.
One of the pleasant surprises to me is that the overwhelming majority of spine surgeons, who you would think would be the most resistant to a program like this, their reaction has been, it's fine because it improves the quality of the referrals that I get.
Yeah.
And for the surgeons that I would want to refer to, that's what I want them to say.
Absolutely.
One of the keys to this particular program was that when you talk to primary care docs, in their own head, before we put this program in place, they had no alternative. Their alternatives were order a test, prescribe a medicine, send them to the specialist.
Yeah.
And so we were able to say, well, primary spine care is a specialty by itself. If we can help them understand that, and so that they have confidence that they send their patients to one of these providers, that they'll actually get their problem managed, and it won't come back to haunt them as the primary care doctor. They're happy with that.